Okay, everyone, Dr. Hall back with you again. We're going to do an introduction to disorders of menstrual timing. We're going to talk more about these with the next mini lecture, but I'm just going to kind of introduce some of the concepts here in this section. So first, a reminder of our definitions, right? So menarche is your first ever period. Menses is what we call the period. Day one of a cycle is the first day of bleeding, the first day of the period. LMP is the first day of the most recent period. So it's the day one of the most recent cycle. Cycle length is the time from day one of one period to day one of the next. Cycle duration is how many days you bleed. And flow is, of course, how heavily you bleed. So regular means that interval, that cycle interval, the time from day one of one cycle to day one of the next cycle is relatively the same. Irregular is if it changes from month to month. If it is irregular, then it is often going to be either oligomenorrhea or periods of amenorrhea. So oligo meaning few. So cycles are the cycle length is more than 45 days from one period to the next, or fewer than 9 periods in an entire calendar year. And amenorrhea is if you go for 3 months or longer with no period. Of course, the most common cause of amenorrhea, or one of the most common causes, is pregnancy. There are other things too, as we'll discuss. So here's a little practice. So this is somebody's menstrual calendar. So they've taken a standard calendar and they draw a line through the days during which they are bleeding. So we can see at the beginning of this calendar, she gets a period starting January 6th. And it lasts for 4 days, so cycle duration is 4 days. And then another period starts again on January 27th, which is exactly 3 weeks later, or 21 days from day one of one cycle to day one of the next. So this person's cycle length is 21 days. So then if we look moving into February, and we can see again it's exactly 3 weeks later. Then we look into March, exactly 3 weeks later. So this is someone who has frequent menses, but they are regular, okay? Frequent, but regular. Here's a different calendar. So this person had a period on January 5th, and then didn't get another one until February 25th, right? So 1, 2, 3, 4, 5, 6, more than 7 weeks later. And then the next one was April 12th. And then there was one in June and one in August and one in October, right? So they're kind of going every other month. And you'll see that it's not consistent, the number of weeks in between each one. So this is irregular, and they've had fewer than 9 periods in this entire calendar year. So this is oligomenorrhea, few periods. Something is wrong. All right, here's another one. So they had a period in January, they had a period in February, they missed one in March, had one in April, and then they haven't had one since, right? Because we're in October now. So this is someone who hasn't had a period in 3 months or longer. So this is amenorrhea, right? Absence of periods. It could be that this person is pregnant, or it could be that something else is going on. So the thing about menstrual cycle timing and why we care so much about it is that in order to have a period, that means that whole menstrual cycle has to be operating correctly. You have to have that follicular phase where the hypothalamus makes GnRH, the pituitary makes LH and FSH. LH tells the theca cells to make hormones. FSH tells the granulosa cells to encourage the oocyte to mature, right? Then you have to ovulate successfully. And then the empty follicle has to turn into a corpus luteum. The corpus luteum makes progesterone, which causes the endometrial lining to build up. And then the corpus luteum gives up, progesterone levels fall, and you have a period. So if you are having a period every single month on a regular schedule, right? So if your cycle interval, cycle duration is the same, then you're probably ovulating regularly, right? Because once you ovulate, then the rest is almost kind of on autopilot. It's very uncommon for there to be problems with the corpus luteum and the uterine lining themselves. The place where the things go wrong most likely is with the whole follicle maturation process and ovulation. So in general, if you're not having monthly periods, you are not ovulating regularly. Because once you ovulate, you're going to go ahead and build up a lining and shed it, unless you get pregnant. So in order to be regular, right, this whole symphony has to be operating together, right? And so anytime somebody isn't menstruating regularly, we can also infer that they aren't ovulating regularly. Because if you ovulate, you're going to have a period unless you get pregnant. So when we talk about disorders of menstrual timing, it's usually a problem with ovulation, with that follicular development, maturation, and ovulation. So again, if somebody isn't menstruating regularly, you can be sure that they aren't ovulating regularly. And so in that way, menstrual periods can kind of be a good sign or indicator of good reproductive health. And it can indicate that you're fertile, right? That you're releasing an egg once a month. This is, of course, if you're not on birth control, because birth control can also make you have a period once a month, but it works differently, as we'll learn in a few weeks. So there's a little warning here. So the thing about the endometrium is you might remember in the follicular phase, estrogen levels were high. And then in the luteal phase, and that caused the endometrium to start to build up. And then in the luteal phase, progesterone levels were high, made by the corpus luteum. And that caused the progesterone to move into the secretory phase and get even thicker. What happens if you don't ovulate regularly is you generally have more estrogen around than progesterone. The balance is off. And this causes the endometrium to get kind of weird. And it can cause either irregular or absent bleeding or a combination of either, right? So everything just gets chaotic and disorganized if you don't have that normal sequential marching through of events. So not only do you get irregular or absent or unpredictable bleeding in terms of periods, it also ends up increasing the risk of endometrial cancer. So that's why, as a medical person, I really care about whether somebody's periods are regular or not. Now, the caveat here is that this is not true if somebody isn't having regular periods because of the birth control that they're on. Right? If they're not having regular periods because of the birth control that they're on, we're doing that to them. And it's not, and whenever we put somebody on hormonal birth control, we make sure that there is not this relative excess of estrogen. So when we're doing that to somebody with hormonal birth control, they are not at increased risk of endometrial cancer. In fact, they are at decreased risk. But if somebody on their own is not having regular periods, then something's wrong, right? Because something isn't working the way it typically should. And they are at risk, increased risk over time of endometrial cancer. All right. So in summary, the first thing I want to know with somebody's periods is, are they regular or irregular? And if they're irregular, most of the time it's either oligomenorrhea, few periods, or amenorrhea, no periods. And so remember, these disorders of timing are almost always due to a lack of regular ovulation. And if you aren't ovulating regularly, then you have these times where your endometrium is disorganized because your balance of estrogen and progesterone is off, and that increases your risk of endometrial cancer over time. So in 9C, we'll talk specifically about the three main disorders that cause irregular periods and lack of regular ovulation.